In this video, I'm going to show you my 7 favorite exercises for hamstring strains that have not bruised. Hey, I'm Sebastian in Performance Play Sports Care, part of locally world famous chiropractors in Costa Mesa, California. In this video is going to be a follow along one. There's going to be a countdown timer in the corner, and this is hopefully a video that you're going to come back to the entire month on a daily basis to do some of your rehab with me. Now, the types of hamstring strains I'm talking about, again, are the ones that did not bruise. The reason why it's important about the bruising is if it bruised and it's traveling down your leg and there's a big old mass of discoloration, then the timeline changes. If you guys are dealing with something like that, you can talk to us about it so we can formulate something more appropriate for you, but this is not it. This is mainly for people who have dealt with a hamstring strain without bruising, and it's been about a month or so, and it's really not getting itself better. All you're gonna need for these exercises is something to sit on. This box is gonna work well for me, but you can use something like a chair as well. At this point in your care, really there's 3 things that you should be considerate of. There's 3 basic goals. The first one is increasing hamstring mobility without actually tearing the scar again. The second is you want to take load away from the hamstring by offloading load to other regions like the hip and the core. The third thing is lightly loading the leg to tolerance. Now, to actively lengthen the hamstring or getting active mobility, the first thing you want to do is get a box or a chair, and we're going to scooch all the way back on it and then start to slowly just kick the leg out. Okay, this does not need to be super aggressive, all right? Everybody's at a different point in their recovery. Some people may be way more aggressive on this than others, but all you're gonna do is just lightly extend into the point where you start to feel a little bit of a tug, and you're gonna know that that's kind of the end. And so if I felt it right into here, I would actually go a little bit lower in that range to essentially milk the range that's not painful. We have to actively get range in the hamstring, and we're using the quad contraction to allow the hamstring to move through its tolerable range. Early on, people don't tend to realize that when there's been an actual tear, there's actually jelly that's formed between the sides of the tear. You have to allow that to actually scar up if you want to have your hamstring transfer load again. Now, the second one we're going to do is more of like a fail-safe. We're going to go here, and we're going to go just like so. Okay, you might not be able to go the whole range as I am. You might be here and just going like this. But what this is flossing the sciatic nerve. Now, this may not be the most important thing to everybody, but this is a consideration that's actually pretty important when it comes into full recovery of the limb, is that if the hamstring had a tear or a strain and it started to stiffen up, sometimes the sciatic nerve may be caught between the hamstrings or in the region and compressed. And so providing mobility of the sciatic nerve through the interface of the hamstrings is really important. And in order to do this, you cannot move the hamstrings. You need to move the nerve, which is attached to the foot. So these first 2 exercises or stretches are mainly targeting mobility of the hamstring as it starts to recover. Now, the next few we're going to go through are going to be more of taking load away. The first thing you need to do is get the belly to work. And for this, we're going to use a plank. We're just going to go here, hold. If you can hold the whole time, great. If not, don't worry about it. We're going to go for a little bit of a break. To refine the movement, you can tuck your hips under just a little bit, keep them tucked, and then come up and come down. This may seem silly, but you know why it's called a plank? Because you're trying to be like a plank of wood. You shouldn't be a crumpled up plank of wood like so. And so make sure that you're keeping a straightness about you and just holding the position. You should feel this in your belly area. If you feel in your hamstrings, you should regress to a knee plank that I'm in right now, or a knee elbow plank such as here. Okay. Next thing we're going to end up going to is a side plank. A side plank's going to be like here. In here. And you're going to hold. You're not going to be able to go the whole minute. Most people can't in this one. And then you're going to come down, pause for a little tiny break, and then go back up again. Again, the point of these fuller exercises that are not particularly the hamstring is because we need to make sure that we're building support for the hamstring. The core, the pelvis are very, very important in regards to hamstring function. We know that from a lower cross type of model. The hamstring will over-recruit when other musculature is not doing its job. The obliques, the core as a stability unit, as well as the glutes, are really important to take excessive load away from the hamstring, which is what you're going to want over time, because this thing doesn't just strain on its own. There's a reason behind it typically. Good. And we're going to do the other side for good measures as well. Here, push the floor away and slowly return. Now, just a couple other tips as well is do a little bit of pressure into your fingertips on top here. That way you're not overextending as you go up. Pressure and push the floor with the elbow. Pressure, push the floor with the elbow. The harder you push with the elbow and the hand, the more this is going to start to shake, which is a good thing. Now, some of you can actually do it from the feet, and that's okay. There's a knee version here too. It's called a side bridge. It works really, really well. You might have to go a little bit longer, especially if you're in the middle. Like you can only do like one of these, and then you start to gas out pretty quickly. You'll just go through quite a bit of more of these. And instead of doing a minute, you might do a little bit more. We're just going to stick to a minute in this flow here. Again, I want you guys to come back to these videos daily and do them all the time. Now, the next one we're going to go through is a glute bridge. We're going to do a single leg variety here. Tuck and push the floor with your heel. Now, some of you may not actually be able to get up via this method, and I don't want you to cheat yourself up by doing momentum. I just simply want you to push your heel into the floor. If all you're doing is pushing right here, that's okay. What this does is it helps out to facilitate glute contraction more than hamstring. You may get a little hamstring too, but if you do, I want to see if you can tuck the knee a little bit more and then push a little firmer with the heel. All right? If some people feel that actually when they get to the top, they get the hamstring and it feels like it's cramping on them, go just short of the cramp. Take a little longer breaks. The goal is to, again, offload the hamstring at this point before we start to load it. The next two exercises, we're going to load it a little bit more specifically and try to get it to be challenged some so it doesn't get weak over time. Good. All right, we're going to do the other side too for good measures. Tuck and push. Now, a lot of times people feel that after they've recovered from their hamstring strain, they notice that one side's stronger than the other. Sometimes people actually find that the side that had the strain is stronger. And I've noticed that I think it's because people just spend more time on it. They forget that the other side is a player too. The body works as one big unit. It's hard to separate things. So it'd be in your best interest to make sure you're doing these on both sides. That way you're not going to make the same mistake that most people do, is they just kind of pay attention to the one side that's screaming. Now, if you start to feel this cramping in your hamstring as well, another method you can use is hand on belly and push your guts into your belly like you're trying to be fat. Sometimes this in itself stops people's hamstring from cramping. It shifts a lot of the load to the core versus the hamstring. Now, the next one we're going to do is a long levered bridge. It's actually a bridge that's biased more towards the hamstring, so you're going to slide your heels out a little bit and then push into the ground. All right? This is a long levered bridge. Again, belly pressure, push, and I'm going to try to make a straight line from my mid-back to my hips to my knees. Now, this is a pretty hard one, and you can make it a little bit easier by sliding a little bit more in, or there's a version called a heel dig, which is here, and just pushing the heels into the ground. There's no movement up. It's just pushing down into the floor. You're going to want to hold this for about 2-3 seconds and then back off again. It's a very, very hard one. And again, the point is to lightly load the hamstrings to the point to your tolerance. We don't want to go beyond the hamstrings tolerance. The way you know if it's the hamstring tolerance is being surpassed or not is because it'll start to hurt. So don't push past the pain. There's no reason to push past the pain in this one. Okay. The last one we're going to do is a box squat. You can use a chair if you'd like. A box squat is pretty simple. You're just up and down. If you do this prayer type of position with the hands, it's kind of nice because it helps keep pressure in the abdominal area by pushing. You'll notice it's impossible to push into the fingertips without using your belly, and you're just up and down real slow. Now, some people have no pain, no pain, no pain, no pain, my hamstring. In that case, this box is too low. And so you can stack up books or anything else you got around the house just to raise how high it is. Just nice and slow, no quick movements. Imagine like you're sitting on a glass box, don't break it. Maximizing your time under tension. Okay, so these are the exercises I like people to do when they're about a month or so out, when they don't have bruising. If these are too easy for you, there are ways to scale these things, and quite honestly, programs change. This is not the exercise program you want to use for months and months and months, but most people get away with doing about a month of stuff, and then things need to change because the body adapts. Now, if you want something customized, we can make that for you. Just contact us. We have virtual and in-person sessions, and we see a lot of people with hamstring problems, and we have a really good success rate with it. Now, in this video, if you want to learn more about why these exercises work and a little bit more about the anatomy and mechanics of a hamstring strain, stay tuned. I'm going to cover that right now. Now, to really manage a hamstring strain appropriately, you have to understand a little bit of anatomy and a little bit of mechanics. And you have to know the body works as a big old unit. The hamstring itself did not decide one day just all of a sudden to go badly. Things have been set in motion that oftentimes will create that problem to happen. However, once you do have a hamstring strain, you have to realize that there's an actual disruption of the tissue. And if you imagine this as like your hamstring, like everything's tightly woven, and as I pull on one end, the other side goes, and so on. This is a hamstring that can transfer load from side to side. Now, when you create a little bit of a tissue disruption, then you have a little bit of a spreading of it. And imagine if I'm pulling this side doesn't want to come, right? And there's tears of different sizes and so on. But overall, this section is not really transferring load well. And so the body has a natural way of dealing with this, and it's called scar tissue. Everyone's been demonizing scar tissue for all these years, but realistically, it's your body's glue. It helps out to glue these sections together, but as all glue does not immediately touch and all of a sudden seal both sides. And so your body tends to take a rough timeline, about 14 to 21 days roughly, so 2 to 3 weeks, to really start to narrow that area right there, and it starts to transfer load from side to side. Now, the bigger the strain is, the bigger the tear is, the longer it's going to take, in theory. And so you need to make sure that when you're dealing with a hamstring strain or a tear, you don't start to separate the sides before they're ready too much. You can lightly move them a little bit and manipulate them. That's why active mobilization and not pushing through pain is important. But if you tear the both sides off again, you're just increasing the timeline of your problem, okay? And so that's number one, is that when you go through a program like recovering from a hamstring, you need to make sure that it is structured and well thought out based upon the timeline of your injury. Now, the second thing might be considering, why does a hamstring strain happen in the first place? Well, this tends to go back into a lower cross type of presentation, or we call it a lower cross syndrome. Now, a lower cross scenario is actually pretty simple, but it can get very complicated if you let it. Overall, the theme is that certain muscles will become dormant or weak, while other muscles will become active or tight. A lot of times the muscles that you may recall getting tight probably before the time where you had the hamstring strain is you felt your lower back tighten up and possibly your hip flexors. These groups are called tonic muscles. They tend to recruit really quickly when there's an issue with overall balance of muscles around the pelvis, while muscles like the glute and the abdominal wall or the obliques tend to not really work very well. Here's the trouble though, is that the glute is the main extender of the hip. It's a big player in function of stability of the pelvis and the core. And so when you have disruption around that region and things aren't working well, sometimes the hamstring takes over as a extender of the hip. It's really not a great extender of the hip, but it is an extender of the hip. Now, if you look at me just from here, imagine if I'm coming this way with my leg, at some point my hip will have to extend, right? And so extension partially comes in from the glute max. It's from about here to here. It's a short muscle group, but also it's a very powerful one. And so it grabs and helps or assists as a primary hip extensor. Now imagine if this muscle's not really working too well, the hamstring goes here to here and it says, you know what, I'm going to help you out. I'm going to start pulling a little bit quicker. And so the overload that happens at the hamstring oftentimes precedes the injury, and the injury then is focused on exclusively while you should be looking at the body as an entire unit. Now, some things that you could look at too as an assessment to figure out what may be going on with you that you're really not aware of is something called the SFMA. It's a movement pattern screen where you can see certain things that may not hurt but may be contributors. While a lot of times in a clinical setting we only focus on the painful things because it's where you're pointing at, really a bigger picture approach of looking at how the body works as a unit and sparing the hamstring from further problems down the road comes down to looking at areas that are not painful but are not working well. I'll give you an example. So let's just say I have a hamstring problem on this leg right here, and I squat down and I put more weight onto that side. Why? That doesn't make any sense. Squatting down, put more weight onto that side. Some of you might have had a past history of the opposite leg having a problem. Maybe it was a hip flexor strain, maybe it was a hamstring strain on the other side, or maybe you had an ankle injury on the other side that was really never really fully resolved. Some people have had sciatica or leg pain, nerve pain on the other side, and their body automatically shifts the load away to the opposite side, essentially overloading from that principle. In this scenario, there's nothing wrong with the hip. My hip doesn't hurt, my knee doesn't hurt, my ankle doesn't hurt because they're all old things, but my other side hurts. So that's a scenario where you have an active painful structure, the hamstring on the right, or in case my right, your left, and then the opposite side is the contributing or the root cause. So looking at the body as a big entire unit is very important, and you can do a very thorough assessment like this, but also including more localized hip and knee and ankle and muscle testing exam. And a lot of times this takes a skilled eye to see things like this. They're not as super dramatic as I showed, but essentially a lower cross syndrome is a very easy starting point to figure out why your hamstring is being overloaded in the first place and why it continues to be provoked over the years. Hope this was helpful to you guys, and if you're looking for more information about hamstrings, just contact us. Usually structuring a hamstring program is pretty particular, again, based upon when it started, how many times you've had the strain, and also what bothers it, so looking at provoking or triggering factors. So we can help you design something if you want it. We see people virtually or in person. We'll see you guys next time, and subscribe to this channel.